below. Welcome to our home health solutions.
Facial angioedema, urticaria angioedema. Facial angioedema affects the face of the patient, usually the eyes and lips. Urticaria angioedema, though quite similar in nature, is a different skin problem. The major difference between these two is that urticaria occurs in the upper dermis whereas angioedema occurs in the dermis and subcutaneous tissues. To understand facial angioedema, you need to understand what angioedema is, which is explained in the next section. Angioedema. Angioedema is the rapid swelling of the human skin, resulting in the swelling of dermis, subcutaneous tissue, mucosa, and submucosal tissues. Usually, the swelling lasts a few hours and does not threaten the life of the patient. However, if the swelling progresses rapidly, it can block the airway and cause suffocation, in which case it should be treated as a medical emergency. Epinephrine is a life-saving drug in case of acquired angioedema, but it is not very effective in familial angioedema. Angioedema symptoms. The most common and obvious symptom is swelling, which can develop abruptly on the eyes, lips, tongue, and throat. However, it is not limited to these areas only, and any other part of the body can also be affected, such as the hands and feet. The swelling may result in itching, burning sensation, and pain. Urticaria, hives, may also develop along with it. Sometimes, the patient may also have difficulty breathing. Angioedema causes. Angioedema can be caused by many factors: allergies, for example pollen or food allergy, drugs, for example NSAIDs, aspirin, blood pressure medicines, ibuprofen, and other antibiotics, insect bites, hair dyes, and any other underlying diseases, for example Hodgkin, leukemia, lupus, or it can be a hereditary disease. Acquired angioedema. There are two main types of angioedema, acquired angioedema and familial or hereditary angioedema. Unlike hereditary angioedema, acquired angioedema is caused by factors other than family history of this disease. Hives angioedema. Hives is the common name of urticaria. Hives angioedema, though quite similar in nature, is a different skin problem. The major difference between these two is that hives occur in the upper dermis whereas angioedema occurs in the dermis and subcutaneous tissues. Angioedema Medicine. Medicine is an online clinical knowledge base, searchable by keywords, such as angioedema. Angioedema swelling. Angioedema swelling is the common and obvious symptom of this skin problem. It is usually accompanied by itching and pain.
Angioedema articles, angioedema treatment, urticaria angioedema, hereditary angioedema treatment, facial angioedema, idiopathic urticaria angioedema, quinquedema, more angioedema articles. Click the link in the description for more articles.
Subscribe to receive new posts from our channel. Thank you.